Hey guys, Dr. James Stirrett here. Today I'm going to be just having an honest conversation with you about the top 5 side effects that I see with GLP-1 medications in my practice. So GLP-1 medications meaning Ozempic, Wegovy, Tirzepatide, Zepbound, Mounjaro. What I want to encourage you with today is that you do not need to live with these side effects. You don't need to suffer through these side effects if you are experiencing them. These are going to be the top things that I've seen over the last 4 years, over thousands of patients, become a big problem. I want to identify what the main causes of these side effects actually are, what to do about them, and how we can prevent them going forward. One of the number one concerns for people is actually nausea. Nausea is extremely common, even with a starting dosage. I want to go behind the scenes a little bit and talk about why this is actually happening in the body and what I believe to be the answer. For starters, what causes the nausea is just an overstimulation of the GLP-1 or GIP receptors. So when you take your GLP-1 medication, if those receptors have been stimulated more than they ever have at any point in your life, you're going to end up with like an overdrive response to the medication. Let's say at a starting dosage, you inject it and you feel nothing. Maybe they weren't stimulated enough. Or you inject it and you feel pretty good. You may have noticed some of the benefits of the GLP-1, like the anti-inflammatory benefits, less carb cravings, less alcohol cravings, not wanting food after 6 p.m. or after dinner, not craving it while you're watching Netflix. These are some of the things that are really positive about the medication. But let's say that your body's a little bit more sensitive because this medication is going to hit people differently. It doesn't matter how much you weigh. The receptors, when they get overstimulated, they do have an impact on the digestive tract. And since they have such a strong affinity for the digestive system, they have the potential to cause nausea. I've literally had patients that came to see me that got their medication from a doctor or nurse practitioner online, and Zofran, a common anti-nausea medication, was prescribed preemptively with the GLP-1 just in case of nausea. I find this to be almost offensive just because we should never be overprescribing the medication to the point where a patient gets nauseous. At our clinic, we use a microdosing strategy, so we actually dose a lot less and titrate up to prevent side effects like nausea. However, if you're just going through a standard pharmacy, what you're going to be prescribed, or if you have a Zepbound pen, what you'll be prescribed is 2.5 milligrams. If you inject that, you're going to be subject to that entire starting dosage. You may get nausea immediately. What that means is, going back, is that you are on potentially too much medication already, unfortunately. And I'll talk about what to do about this in a second. If you were to get a full, complete blood draw panel done, a functional blood draw panel done, what you might see is that your fasting insulin levels are not very high. So the level of insulin resistance that you have currently may not be that severe. And so those receptors might not have needed the stimulation that the next person would have. So what are the options? One is potentially stretching out the amount of time in between injections. I've seen this be effective, but I don't advise it because a lot of that medication is just leaving the system. Especially after a week, there's very little left, and you're losing the effectiveness of the medication and its impact at the receptor level. And then you're bombarding it again every time you inject. Instead, what I might consider is, and I know that this may be limiting through insurance for some people, if you were to switch to a compounded product, or if you have a vial of the medication, it allows you a little bit more flexibility. And if you are working with a provider that is able to understand microdosing and able to walk you through the titration of what's necessary, then what you could do is start at a significantly lower dosage and ensure that you're not having any nausea at that point, and bump things up to the point where you're actually getting a result from the medication, you're losing weight, you're feeling good, and you're not nauseous. So that would be solution to number one to somebody who's starting off already at a deficit on the med. Secondly, most people are going to inject. They may notice a nausea for the first or second week, and then their body starts to adjust a little bit. This is great, but where they'll notice nausea is typically where they bump up to the next subsequent dosage. So if you go from 2.5 to 5 milligrams to 7.5 milligrams, you're just doubling your odds of having a problem along the way. If you jumped a level, you don't have to freak out about this, but you may need to step back a little bit. And again, the benefit of having a vial instead of a pen may just be that what you need is something in between the two. You didn't need to double the medication. Maybe you only needed to increase that medication by 10% or so. And I think that's where we're failing people as a medical system, is that it's just simply what the availability and what the recommendations are globally on how to use these medications, I think is really flawed. And I think over the next few years, especially with the craze of microdosing, what you're going to see is a little bit more flexibility in the dosages. So you don't want to have to use Zofran. You don't want to have to use anti-nausea. You don't want to have to be chewing on ginger tablets or ginger candies as you go along to be able to tolerate the medication. So that's just dosage by itself. Now, other things that will cause nausea are going to be alcohol, fatty foods, French fries, fried chicken, chicken wings, going out to the bar for a burger and beers. Like, the medication just really isn't designed for you to be going out and doing that anyways. So if, every once in a while that might be fine, but you may notice that you're going to get sick when you're on anything beyond a starting dosage beyond. Typically, you're not going to feel that great if you eat or drink that way while on this medication. Side effect number 2 is just going to be constipation. Now, in alignment with side effect number 1, with the nausea, remember I talked about the affinity for the digestive system. With constipation, the GLP-1 does slow down your digestive tract. If you're somebody who's prone to constipation already and you start a GLP-1, my biggest concern for you would simply be that it's going to slow your digestive system down even more, and you're going to get more constipated. So what is my definition of constipation? Constipation is not going to the bathroom every single day, essentially. If you're going to the bathroom every other day or every third day, that is constipation. Even if that is your normal, that's okay. Don't condemn yourself, but understand that this is a problem that needs to be solved. So with our clients, what we do is I always, that's number 1. If somebody says, hey, I'm kind of constipated, or I'm kind of on the edge of constipation prior to starting or on a GLP-1, we double down on gut health. We have to solve the gut problems first, because that's like the pillar that everything else is going to stand on for you. So if you are struggling with constipation while on a GLP-1, just understand that if you were on a certain dosage and you weren't constipated, or you were having minor constipation and you just jumped up a full other dose, like again from a 2.5 to a 5 milligram, or from 5 to 7.5 milligrams, just know that you just doubled the medication. So you just doubled the side effect profile of the medication. You may need to step back for a moment and deal with the digestive problem, because I don't anticipate you losing much weight if you're constipated. Remember, constipation is the retention of toxins. Your toxins are being reabsorbed from your stool continually. We need to be able to eliminate effectively each and every day. The funny thing is that constipation can be a problem when trying to diet and lose weight anyways, just simply because what do? We want to eat high protein, low carb. And what do we do when we go low carb? We cut out high fiber foods. So first and foremost, we want to make sure that you're getting enough fiber. I usually use psyllium husk fiber or similar types of products, 1 to 2 tablespoons of that a day mixed into water. Along with the water, we want to make sure that you're drinking enough of that throughout the day. The question you want to ask yourself is do you get less than 60 ounces of water per day? If you're thinking about it and you're like, well, yeah, maybe you get less than 30 ounces of water per day, and you're drinking coffee on top of that, which is a diuretic and going to dehydrate you, we've got a problem. You need water, you need fluid to have a bowel movement, and just being on a GLP-1 is going to be a little bit dehydrating as it is. So we have to double down on your water intake. We need to make sure that you have enough fiber. And then most people have taken antibiotics in the past. They've wiped out their good intestinal flora. And so most people are going to need a quality probiotic. One of the biggest things that I would say to hit the brakes on is if you listen to what I just said there and you're like, oh, I'll eat more yogurt or kefir or drink more kombucha. I would do none of those things, especially when it comes to inflammation in the gut and constipation. Set those things aside. Actually get yourself a real supplement, not something off the drugstore wall that's, $10 bottle. You're going to need something probably a little bit higher quality than that to get the job done here. Number 3 is going to be muscle loss. And muscle loss happens again when somebody works to too high of a dosage. Think about it in the same way. If you are on, let's say, 2.5 milligrams and you're able to eat a sufficient amount of food, let's say, if you're a male, you're eating 1,800 calories. If you're a female, you're eating 1,300 calories. All is going well, but you're not really losing that much weight. So your provider's like, hey, let's bump you up. Let's double you. And now you're on 5 milligrams of Tirzepatide, and all of a sudden, boom, you can't get over 1,000 calories anymore. One, a lot of people still don't lose weight under this scenario because there's another reason. There's another reason why you're not losing weight besides the calories themselves, which is why we run blood work and we make sure that we're adjusting people's diets. What it boils down to is that these dosages, these higher dosages, people just don't want to eat as much food. And so when the calories drop, the protein levels often drop along with it, and people find themselves in a position where they're losing muscle, especially if you're not active enough. So let's say you have a desk job like me. You know, even though I got a standing desk and I try to move around, if I'm not consciously moving around, then I've just basically stood or sat all day. It's not good, and it's not good for people that are trying to lose weight on a GLP-1, because if you pair that with not enough calories, you are going to lose muscle. How do we fight this? Make sure you're moving your body. Shoot towards 8,000 to 10,000 steps per day. I know that's a lot for some people. Just start where you are. Just start trying to add an additional 2,000 to 3,000 steps on top of whatever you're doing, especially if you're only getting like 3,000 steps a day. Move your body. Eat protein. Make sure you're getting in enough calories. Yeah, like it's okay to eat at a little bit of a deficit, but if you're eating under 1,000 calories a day, it is a way to lose weight, but it is not a sustainable way to maintain weight loss, because as soon as you come off the GLP-1 or you move to a lesser dosage of the GLP-1 ultimately, and your hunger comes back, you start eating more calories. If that's how you maintained your weight loss, you're going to gain it back. Number 4 is hair loss. Now, a lot of people worry about their hair on GLP-1s. This is going to fall into the exact same category as muscle loss. If you work up to too high of a dosage and you are nutrient deficient, you're eating too few calories, and you're not taking in enough nutrients, your body sees this as an extreme source of stress. And what does extreme stress do to the body? It will cause us to lose hair, whether it is a painful, emotional problem, a traumatic event, or a dietary stressor on the body that's significant, like starving yourself, essentially. This will cause you to lose hair. So is it the GLP-1 that's causing it, or is it just the lack of calories and the lack of food going into your body and the malnutrition that's occurring? I will say that also on a GLP-1, it's really important that we're evaluating certain things prior to getting started. Iron status, ferritin, making sure that iron and iron storage looks good. Full thyroid panel to make sure that your thyroid isn't impaired, because if your thyroid's messed up, then you're going to lose hair. All of your hormones need to be checked out. All of this in addition to make sure somebody is actually eating enough food. So if you're on a GLP-1 and you started losing hair, get some blood work done. Make sure you're eating enough calories. If you're on too much medication, you need to be working with your provider or another provider to be able to work you down. The 5th symptom that I see regularly is actually heartburn, believe it or not. If this GLP-1 medication is going in, it's making your digestive system go a little slower. That means that anything that's going into your tummy is going to be digested a little bit more slowly. So if there's a problem in there, if there's a problem with your digestion, it's going to expose it and it's going to squeeze. Let's say that you're not really digesting your food correctly or properly initially. Maybe you struggle with occasional heartburn, or maybe even none at all, but you do still have a little bit of an inflammatory response happening with your food. Maybe you've got a lot of bloating going on, something like that. And then all of a sudden you get on a GLP-1, it slows and it basically makes that process that's inefficient even less efficient. Now all of a sudden you're going to get some gurgling up, and that's going to cause heartburn for you. What I can recommend here, again, the probiotic might be helpful with this, but just evaluating what's going into your diet, seeing what may be exacerbating it, whether this is spicy food, dairy, nightshade vegetables. These are common sources, common problems that I see people have with heartburn. I would make sure to pull those out 100%. With our patients at our clinic, it's really a combination process. Like, in order to heal somebody's digestive system, or in order to really put out the fires in the digestive system, it's like a 3-part process. We always do a dietary elimination to some degree. We always use very strong probiotics, and then we have a customized protocol that we'll do just to help stabilize the inside of the intestinal lining, depending on what we're seeing in the blood work and also depending on what that person is presenting with. But for those of you just listening to me here that are like, oh, I do get heartburn, pay very close attention to the things that are currently giving you heartburn. So if you're like, oh, I always get heartburn after I eat this specific food, well, make sure to do a little research. Dig in. Like if it's tomatoes, like you want to consider not eating any of the nightshade vegetables, because all those nightshade vegetables will have varying levels of those exact same compounds that are in the tomatoes. Or if it's dairy, like maybe stop putting creamer in the coffee in the morning, because a lot of people will say, oh my gosh, I think it's my coffee, but it's actually just the creamer that they're putting in there. So hopefully this was helpful. If you're listening to this and it's resonating with you, like you're like, oh my gosh, like I'm having side effects, or I don't want to get side effects, and you're wanting someone to help you through the process, our team does this with each and every patient. We always do a full assessment and intake. We always do functional blood work with each and every person we work with. And your digestive system is of fundamental importance, along with the correct dosage of the GLP-1. So if you're wanting to get walked through a process like that or are looking for some extra help, please apply to work with us down below. Otherwise, please refer this to a friend that's having some digestive turmoil with GLP-1s. You got video up here in the corner. The algorithm's really smart, so it knows what you want to watch next. Go ahead and click it and watch now. Otherwise, God bless. I will see you next week. Take care.